Yeah, thank you. Why don't you tell me what's going on your end, Maria?
Well, I am focusing right now on fundraising, which is very critical so that we can accelerate these cures, which this is just a matter of time, really. These cures are going to happen, but the question is, can we make them happen faster? And funding will definitely help that. So my main focus is on that right now.
That's great. And have you traveled around recently, around the globe, reaching out to people?
Not as much as I should, I guess, but we still have to explore a lot in Asia, for example. Yeah, we haven't had the kind of budget for us to travel around the world too much, but there's a lot of people with a lot of money in the US, and we get the chance to meet with a lot of high net worth individuals here. We think that there's some good synergy right now going. Yeah. Things are starting to move faster. I started doing this about 10 years ago, and it's a big, big difference right now. A lot of people are wanting to get involved because it's looking real. Yeah. Yes. Before it sounded more like science fiction, but now science fiction and science are meeting. So
yeah, it's pretty funny. We got a guy on here, Haynes Turian. He says he's always watching Aubrey's face to see if he has secretly discovered the cure to aging yet. Funny.
I wish. That's funny. That's funny.
We got a good group of people here online, so they'll be asking questions and stuff, and I'll be relaying them to the panel. So
very nice.
Fantastic. Well, great. One thing that I know is very important. What you're saying, Maria, is that fundraising is huge. So we're definitely going to try to work to get kind of investor groups somewhat connected with us. I still want to make sure that our conversation is about the science and about what's really potentially out there for people. But I know that, ultimately it's going to help people and patients. And Robin, that's what you're about. Tell me what's going on for you. How has the Forbes article been received?
Oh, amazing. So the Forbes Japan did a 6-page article on me that launched about 2 weeks ago. Yeah. Just in Japan, so 80,000 magazines distributed, and I'm doing my first keynote in Tokyo in December. But before that, I'm keynoting New Zealand Bio, I'm in Vienna, Austria, and Athens, Greece. So basically, I live on airplanes.
Frequent flyer miles.
Exactly.
There you go.
So yes.
Yeah. Maybe you could get Maria to fly you, because I understand she has the plane, right? And is a pilot. And then she could start to network with all these people in Japan.
My plane is a little bit too slow for her tour. I think yeah. She will be late to all her talks.
Yeah, we don't want to make
that. So what the patient as CEO though is it's about the convergence of exponential technology, not only disrupting medicine over the next 2, 5, and 10 years. And of course, technology means things like tissue engineering and genetic sequencing, but also in addition, it puts the patient in the driver's seat, right? And it gives us access to tools and information we never before had even dreamed about.
That's wonderful.
Yes, yeah. And can you tell me a little bit about what's going on with the Organ Preservation Alliance?
Sure. So this is a nonprofit I co-founded with a team, and we exist to catalyze breakthroughs in tissue engineering and cryopreservation in order to eradicate the world's transplant shortage. We catalyze those breakthroughs by both aggregating the science, aggregating the scientists, right? Creating that roadmap to success. So what do the different stages of cryopreservation look like from an engineering type of point of view for the scientists to build on. But then we also work with the White House and the Department of Defense to help create grants and excitement so that we can get the funding to the actual scientists. And there were grants coming out of the Department of Defense last year that were specifically around the different stages we had identified of cryopreservation. So it does get back to that funding avenue of there are unexpected places that you can look to raise money. If you can get like the Department of Defense excited about something, they can create grants for that.
That is so awesome. And I know that, absolutely, that Aubrey has been working to get people excited about regenerative medicine for years and years. So Aubrey, how is it going on your end?
So of course, I'm working closely with Maria on the fundraising for SENS Research Foundation. Still, the situation is, as you said, pretty difficult. And of course, we've got very good scientists now, so I've been able to delegate most of the role that I have historically had in overseeing science. So I still do plenty of that. But I spend a hell of a lot of my time doing interviews and talks and all manner of different types of ways to bring money in the door. One thing that has changed over the past couple of years, and it's continuing to change in a very heartening way, is that it's not just the foundation anymore. A number of our projects have moved far enough along that we've been able to spin them out into startup companies like iCore, for example, or Ocean, which are very closely aligned with us and allied with us, and we help to bring them investors and so on. But the point, of course, is that there are plenty of people with plenty of deep pockets out there who are just, not inclined to be philanthropic, at least not to visionary, cutting-edge science, and yet they will be interested in having an investment, even if it's a very high-risk investment. So we're pretty happy with the way that that's all been going, and certainly more and more major investors are coming into the arena right now, and we're hoping to make that happen increasingly. One thing that I should also mention is Ajax, which is a company that is run by Mike West, a very famous person in the whole anti-aging field, who founded Geron way back 20 years ago or more, and also founded Advanced Cell Technology, which was one of the first companies working in embryonic stem cells. These companies played an enormous role earlier on in taking regenerative medicine for aging forward. And more recently, he's been running a company called Biotime in the Bay Area, in the East Bay. And Ajax is a subsidiary of Biotime that has just been created. Mike reached out to me and asked me to join in a senior capacity as the Vice President of New Technology Discovery, which basically means I do what I do best. I come up with new ways to put 2 and 2 together and make 17 scientifically, and how to actually exploit the intellectual property that they have, which is very considerable. The main area that they are pursuing is a technology that they developed way back some time ago now, actually, as Advanced Cell Technology, which is now called PureStem. And it's all about having the ability to take very primitive cells, like embryonic stem cells, and differentiate them, but not just differentiate them in any old direction, rather to differentiate them with high purity, high reliability in a particular direction, so that they become a particular type of what's called lineage committed cells that will only make one other type of eventual adult cell. And
so can I ask a question about that? So I've read some, like recently after the FDA did the Cures Act, Texas was the first state that signed a bill that allowed for stem cell therapy for patients that were critically ill. But one of the language in it was that it had to be minimally manipulated stem cells. So is that kind of what you're talking about? Is that along the lines of that?
Oh, no, not really, no. This is, so minimal manipulation is a criterion that needs to be satisfied if a stem cell therapy can be used that does not itself need full-blown FDA approval. So it's a bit like the difference between pharmaceuticals and nutraceuticals. If you're doing something that's only minimal manipulation, then it doesn't count as a therapy. But minimal manipulation means really minimal. It means basically you take cells out of someone and you put them back in again without doing anything to them, without even culturing them, let alone differentiating them in a particular direction or anything like that. So no, this technology that Ajax has is something that would definitely eventually need full-blown proper clinical trials and FDA approval. But of course, it would be much more powerful than the minimal manipulation.
We're losing Aubrey a little bit, right?
We did a little bit. The last sentence you said,
yeah.
It's going to take full blown. But this is a company that's publicly traded. Is that correct?
Not exactly, Biotime is publicly traded, and Ajax will be publicly traded. I believe that Mike is hoping to make that happen within the next 6 to 9 months. But as of now, Ajax is simply a subsidiary of Biotime.
Okay, wonderful. Well, what do you think? I mean, I just started, I kind of mentioned about FDA and the Cures Act. I think that is a gigantic door that's opening for a multitude of regenerative medicine techniques. I mean, and it gets into tissue engineering. Of course, you know that Patrick and I are involved with Organovo. That's how this all started. That's how I started talking with David Goebel, and that's what opened our eyes to regenerative medicine as a whole. But I know that recently the FDA came out with this is specific to stem cells, but came out with kind of a caution letter saying that there were some bad actors that were out there. This came out on August 28th. I think because Texas is actually, the law is in effect September 1st. So there was some pressure there. So Gottlieb came out and said, oh, you can't trust everybody. And I thought he played a little bit of fear into the market and I got a little bit upset. I'm like, you know, you can go out and buy a pack of cigarettes and smoke them without a problem. But if, you know, if somebody's going to take their own stem cells and, you know, filter them and maybe try to cure macular degeneration, whoa, hold up, you know. So what do you think about that? Do you think it's going to be harder than people think? We're still a few years out from actual like mass ability for patients to benefit. I see like benefits in joint repair and stuff like that. What do you think?
Well, of course, this is not new. We have known for a long time that the regulatory regime within the US, and also for that matter across the whole of the industrialized world, is very risk averse. It really, you know, and this is not really the fault of the government, because it is a pretty accurate reflection of public opinion. The fact is, you know, when things go wrong in a clinical trial, you know, all hell breaks loose. There was a time about 20 years ago when one person died in a gene therapy trial, and every gene therapy clinical trial worldwide was closed down for more than a year. It's completely insane. And this was because of public pressure, right? Now, you know, I think we need to fix that, absolutely. I think we need to educate people to be more capable of evaluating the cost-benefit ratio. But as things stand, that's what happens. Whereas, of course, if it takes a very long time to approve a particular drug or a particular therapy, and a lot of people die as a result of not being able to get it, that doesn't make the headlines at all, because nobody can see those people. It's something that we've got to fix, but we have to fix it at the level of public opinion. We won't fix it at the level of public policy until we fix the public opinion.
Also, what I want to add to that is that I think the FDA has to renew or update a little bit of their structure and their processes, because science is going so fast now, and it's going faster and faster every day, but the system is staying behind. So when they approve one drug, we already have 5 more that are in the lab already working, and they're not doing it. It's very scary.
And to be clear, that is actually happening to some extent. So, in fact, one of the PhD students that we recently funded in England at the University of Oxford, who has now gone on to rather greater things and is playing a very big part in what we do, he was working on exactly this problem, something called adaptive licensing, which basically means approving drugs earlier in the clinical trial process than we normally would see, and somehow compensating for that in terms of the risk-benefit ratio by doing more sophisticated monitoring and analysis of the behavior of the drug, the safety and efficacy of the drug, after it's been approved. This is, of course, there are many different flavors of that concept, but it's a concept that was really not being discussed at all until maybe 10 years ago or even less, and now it's very much the thing. And, you know, the changes in policy along those lines are definitely going to happen soon.
So, yeah, they're starting to do that and fast-tracking some of these trials, but it's not fast enough for my taste.
No, it's like based on their past. And I know they have a regenerative medicine innovation program, but it sounds like you know, it's more of the slow, you know, innovation, you know, by the FDA wings. I wonder about Japan, though. It would seem that you guys would have some connections with the scientists in the field. And I mean, I think that Japan is leading the way as far as ease for therapies to reach the patients. And I don't know. What do you think about that?
It's kind of there are the fact that the ability to de-differentiate cells and to make these things called induced pluripotent stem cells was invented in Japan has turned out to be a big deal. The Japanese have decided that this is a real issue of national pride, and they've put a huge amount into becoming a really major player in the stem cell arena. And this does go all the way.
Give a shout out to that doctor, right? Was that Yakanama? Is that how you say it?
Yamanaka.
Yamanaka.
Yeah. But what this has translated into is all the way to the clinic. For example, there's a company in Australia called Mesoblast, which has been around for a little while, and they've been looking to try and move some of their products into the clinic. And Japan was the first place in which they were able to do that. And I think that's going to be the first of many examples of that kind of thing. So, yeah, I think Japan will be a major player. But I think it will tend to be a major player in collaboration with the West rather than on its own, because I think the skills and the innovative capabilities that Japan is known for are not really the same. They are more complementary to what we see more in the West.
Well, I think we could send a spy to Japan to get the work done, and perhaps
I'll volunteer.
I was going to say the same. I love Japan.
So can you guys tell me a little bit about Rad Fest? All three of you were on stage at Rad Fest. So I don't know, maybe go around a little bit. Robin, tell us what your experience was.
Sure. So they really got into a lot of the science that's going on behind treating aging like a disease, or like trying to look for a cure for aging. So it was really interesting to see the different verticals scientists are working in right now. And then, of course, there was a focus on the wellness and the preventive medicine aspect, because it really is in our hands how fast and how quickly we're going to age, and if we're going to make it to the level that we want to when we can actually cure aging, right? So really big focus on the wellness aspect too.
Yeah, Rad is a great event. I love it. I think it's, I like the fact that it's an event for everybody. So it has a little bit of everything at all levels. And it's also fun, you know, it's not just a academic conference, which is always very interesting, but it also has a lot of entertainment, and they pay a lot of attention to, the part of networking. It's just very interesting. You definitely have to come next time, as you said, because it's an experience. It really is an experience.
Yeah, I want to support what the other two have said. I think that it was not at all obvious that an event which was this broad-based in spanning all of these different audiences could really work. But yeah. I've got to really congratulate Jim Stroll and his colleagues for showing that it could work. And they've done it twice now. I think it's definitely proven now, and I'm sure it will be continuing to be a success. Of course, they're moving it global now. They're going to have a Rad Fest in Bangkok in a few months' time. So we could see this being a very rapidly growing movement.
That is fantastic, because the more the conversation gets out there, and I love the connection too. It looks fun right off the bat. They have good marketing so that, you know, it could be anybody that walks into the conversation and ends up making an impact on regenerative medicine in a number of ways. And I mean, it's, to me, the more I'm learning about it, regenerative medicine, it's just an explosion that you could go in a million different directions and find areas that are impacting it. One thing that I would have loved to talk about for what I'd like to talk about today is CRISPR-Cas9, and just get your feeling on that. I know that's probably not an area of expertise for you, you guys, but what do you think about it?
I want to say something before you keep talking about this that I've been trying to memorize. Clustered, regularly interspaced, short, palindromic repeats.
Woo! You got it. That's great.
Got it. That's what I want to say about CRISPR. Okay.
Very good. Right. So, we're very interested in CRISPR. I mean, since it's such an extraordinarily versatile tool, it has become a really, vital thing for every lab to know how to use and to apply in various applications. We've been applying it over the past couple of months for one of our internship programs. An intern that we had in the lab who was working on part of our mitochondrial project. We were very happy to get some restricted funding for a project that needed to use CRISPR, and so we've got some experience of that now.
So just on a layman's term, so CRISPR, correct me if I'm wrong, we had the name from Maria, which is great, but it's essentially an enzyme that attaches to the DNA and can snip out bad DNA and either leave it like that or insert a different DNA gene, the actual genome, right?
Yeah, that's basically right. Yes, it can make small changes to the genetic sequence, to the DNA sequence within the chromosome.
So is this the thing? I keep saying it to people. I'm like, this is the type of thing that can absolutely eradicate Down syndrome, or can absolutely eradicate sickle cell anemia. Is that correct?
So not Down syndrome, no, because Down syndrome is caused by having an entire additional chromosome, which is not something that CRISPR would be able to do anything about. But there are quite a lot of inherited diseases which are caused by very small, typically just one base pair that is incorrect inside one gene. And insofar as that mutation is, once that mutation has been identified, which of course is not necessarily the easy part, then yes, absolutely, CRISPR can in principle fix it. There are, of course, complications. For example, it may be much harder to fix it in someone who's already alive and suffering from the disease than it would be in their offspring. But in general, it's definitely the way of the future. The real reason why it's so useful is that even though it's just one enzyme, this thing Cas9, that one enzyme can make any change you like to the genome because it uses, as a kind of template to tell it what to do, it uses another nucleic acid, an RNA in this case, which is the kind of the kind of signal that says where in the genome the modification needs to be made. Now, there's one thing, however, that CRISPR absolutely can't do. Well, there's more than one thing. I mean, I just mentioned it can't fix Down syndrome, but the big thing that it can't do is insert new genes into the chromosome. New genes are just too big for CRISPR to handle. However, we think there could be a way around this, and we're working actually with a group at the Buck Institute up in Marin County to develop exactly this. We have used CRISPR to create a small change in a particular location in the genome in mice that allows a completely different enzyme, which also comes from bacteria, but it's a different strain of bacteria, a completely different enzyme, to do another type of modification that does involve incorporating large amounts of new DNA. So we believe that the combination of these two technologies has the ability to completely transform what we can do with gene therapy, even in people who are already getting on.
That's awesome.
Well, that's awesome. Yeah, I'll revise my statement and just say it can do some amazing things, make sure I'm speaking correctly. Yeah.
So I just want to tune in here just to keep the audience going. We do have 44 people watching live right now, and William McKeever.
Did we lose someone who was in the chat with us? Patrick?
Yes, that's me. Can you hear me?
I can't hear you because you muted your, yeah.
Yeah, so no, there was supposed to be somebody from Methuselah, but they didn't join on the call. So I think it's just been us. Yeah.
Okay.
Can you guys hear me? Okay. So let's go to one of the comments here. One guy says, William McKeever says, can anti-aging slow.
I have a filmmaker who came from England who is working on a project. He wants to do a documentary on life extension. Here's David.
Okay. Hey, everyone.
What's up, David?
Thanks for having me.
Of course, yeah.
Awesome.
So we're having a conversation that I don't know if you can actually hear because I have my headphones with.
What's up, guys?
Okay, well, I'll just grab a couple of shots, but I mean, it would be great to listen.
You know, in addition, just so people know, and you know, we are recording this, so it'll be a YouTube video that perhaps the filmmaker could pull snippets from and make as part of the presentation. So Pat, you said you had somebody that was asking a question about anti-aging?
Oh, okay.
That's the person I said we lost.
There you go. I'm back.
Oh, okay.
Yeah, that's what I was referring to.
So we have quite a few people here.
I just see a circle.
You see.
I don't know what you guys see.
Interesting.
Can you see everybody else, Maria?
Yes, I see everybody else, but I don't see him.
Oh, I can see him, which is, it's one of these weird technology things.
Okay.
Just an icon on your screen.
Do we have any questions from the audience?
Yes, can you hear him talking at all?
No.
We can all hear each other. I guess that's okay.
I think, Matt, you can relay to her. I think she has me on mute.
I'll relay what he says to you, okay? It's possible you have him on mute on your screen, just so you know, Maria. No?
No, okay. He's not loading. There's a wheel going, like, can you load him, sorry?
Okay, well, he'll get the questions and then I'll say them again. It'll be like the can thing, like, hello? Yeah.
Well, so we have a couple people that said, hey, the Rad Fest, the tickets are very expensive. And that's one of the reasons why we are doing this kind of online form, because you get to hear from people like Aubrey and, you know, Robin and the rest of the panels. And we're just kind of, at least I'm kind of just hosting this technically and bringing the conversation to as many people as possible. And then, you know, for them to be able to ask questions, which is really cool. So we have, let's see. Okay, so Eon Cloudus says, wonder what he thinks about Master Roshi's aging. What does that mean?
It sounds like something at the supermarket. The question, Maria, was what does Aubrey think of Master Roshi's aging? I'm going to imagine you don't know what that is. Is that right?
I haven't the faintest idea. Spell it.
You want to spell it? I mean, I don't mean to belittle the guy, but it doesn't sound like...
Okay.
Fire another question, Pat. Let's get to the next one.
I got Marvin over here chirping on my side as if I can handle 3-4 different things at once. It's too small of a screen. All right, so, okay. What's the most exciting news in fighting brain aging that you are aware of? It's a somewhat separate issue because of the BBB and a far more complex system than the rest of the body.
Question was about brain aging to Aubrey, and what's the latest in fighting it? Aubrey?
All right. Well, so whenever people ask me a question like, you know, what's the most exciting development in X, then I've always got a problem because they may want me to talk about things that have just they've just reached the clinic or something like that. But I've always got all this early stage stuff in my head that is exciting me. And of course, the brain is indeed very much more complicated than the rest of the body, but that doesn't necessarily make it all that much harder to fix, because the types of damage that accumulate in the brain are actually just the same as the types of damage elsewhere. However, there are plenty of problems that we do need to still tackle. Let me give this example of a really exciting thing that's going on in the brain right now, and it's very early stage, very preliminary, but I'm pretty excited by it. If you want to fix some aspect of the brain using stem cells, then you have to get the stem cells to the right part of the brain. And in some cases, that's not too hard. So, for example, in Parkinson's disease, there's just one particular type of brain cell, a type of neuron called a dopaminergic neuron, which dies off too quickly and the body doesn't replace it, and that's why we get Parkinson's. And the thing is, those neurons are all located in one very small part of the brain called the substantia nigra. So it's possible to inject the stem cells that may replace these neurons into that one part of the brain, and it just kind of, should work. And indeed, there are clinical trials starting up right now. We're going to have some talks about that at our conference coming up next March in Berlin. But there are some other types of aging of the brain in which, again, we lose cells, but where the location of those cells is very much more distributed all over the brain. And that's much more of a problem, because if you inject a bunch of cells into the brain, they will start out just in one place. And they'll just stay there. They won't, they'll just sit there and not go to the rest of the brain where they're needed. And it's impossible to do 1,000 injections into different parts of the brain and get away with it. So it's a big problem. And there's a group at the Albert Einstein College of Medicine in New York, and this group will also be presenting at our conference in March. And they are looking at genetically modifying stem cells to be injected, so that before they differentiate to replace the neurons that have died, they migrate. They actively migrate. They kind of swim their way through this gooey, sticky fluid called the cerebrospinal fluid that the brain is full of. And this means that they will be able to, to do much more, to confer much more benefit. Now, as I said, this is early stage. The ways in which this can be done are explored, but I'm very excited by it. I think it could solve what may end up being a really major problem in rejuvenation of the brain.
Well, I've got two things for that I'd love your comment on. One is I did see this study. I didn't read it through to see how it was designed, but maybe you heard of it, where they took had a stroke, and unfortunately there was people who had placebo and people who had the therapy, but they actually kind of took a bit out of the head, and they were able to, they injected millions of stem cells in, and they actually had marked improvement. And these were patients that were like 2 years past stroke, and they were very much they haven't shown any improvement in a few years. So they were kind of expected to be exactly where they were, and they had tremendous improvement from stem cells. That's one. I don't know what kind of stem cells or et cetera. But secondly, I did read something about stem cells migrating to an area where it's needed. And I don't know if that's the same technology or it's not. Okay, tell me what's going on.
All right, so about the stroke, first of all, I don't know the particular study you're talking about, but you're quite right that there has been very promising success recently in treating stroke victims, including with stem cells. The thing is, though, a stroke is, as you know, caused by a blood clot, by something getting stuck in an artery in the brain and stopping blood flow, which means that the damage which is done and the death of cells is very localized, rather like Parkinson's disease, as I was mentioning, but very unlike the situation in, for example, Alzheimer's disease, where you've got death going on all over the brain. So it's not too surprising that stem cells could have a significant effect there, but it doesn't on its own give us all that much optimism, cause for optimism with regard to something like Alzheimer's. Now, the migration that you've heard about is almost certainly not this work, because this work is not very well known yet. It may very well be with regard to the way in which the stem cells that already are naturally in the brain perform. So there are just two very small areas of the brain, and in fact in humans there's really only one very small area of the brain in which stem cells still divide and create new neurons even in adults. It's called the dentate gyrus. And the cells that are created there do not stay there. They do actually, as you say, migrate somewhere else before differentiating and becoming and integrating themselves into the network. But the thing is that migration is not controlled. It's not something we can control. It's something that happens naturally, and they have a particular, chemical cue that they follow. They go in a particular direction, and we don't yet have methods for changing which direction they go in so that they go somewhere else if we want them to. So yeah, that's not, it's tangentially related to what I was talking about, but it's not the same thing.
All right, if I can keep going, what about the telomeres, right? Is that what it is? The ends of the
Chromosomes?
chromosomes? Yeah. What's the work that's going on in that? Because I've started to see that kind of pop up. That's a general question, but you know.
Yeah, all right. So, yeah, I mean, there's always work going on in the telomere area. It's definitely a very big and important area in anti-aging medicine. And at this point, the only real bad news is that despite the progress that's being made, we still have a lot of big questions that we don't know the answers to. One huge question that always comes up is, if you find drugs or whatever that could extend telomeres by stimulating telomerase, then would you increase the incidence of cancer? This turns out to be a much harder question to get a definitive answer to than you might think, basically because the impact on cancer might be very delayed after you actually do the telomere therapy, and you know, various other reasons. So that's still a very open question. We'd love better answers to it, but
I think a lot of people don't know about the risk of cancer by extending telomeres. I don't know if it's too complicated to explain already right now, or
it's pretty easy to explain. I mean, the whole point of extending telomeres is to allow cells to divide more often before dying off. And of course, the whole point of cancer is that it involves cells dividing more often than we would like. So it's a simple concept that if we're indiscriminate about extending the ability of cells to divide, then we might have this bad effect. The other problem is that within cancer, there are two types of way in which cells actually extend their telomeres. One of them is this well-known enzyme that everyone has been studying for a long, long time called telomerase. But there's this other method that was discovered 20 years ago now, which is called ALT, A-L-T, stands for Alternative Lengthening of Telomeres. And that pretty much tells you what we know about it. In other words, very little indeed. We at SENS Research Foundation have actually been studying ALT very hard for the past several years, and we haven't got very far with it either. We have made one very important piece of progress, though, which is we've developed a very cheap and rapid assay for the activity of ALT, which means that we can look at a cell culture, a cell line, or a cancer sample and ask how active its ALT pathway is, if it's active at all. And that's handy because it means that if we were to do a drug screen, for example, take 1 million drugs and ask, you know, do they inhibit ALT, we could use this assay to answer that question as part of the screen. That's what we'd like to do. It's tough, though. We don't have any drug candidates yet. We haven't had the money to do a big drug screen. And the result is that the project is actually, you know, looking to be spun out into a company. We'd love to do that. And anyone online who wants to hear more about the possibility of investing in this, whether donating to the project within the foundation or investing in the company that we're creating, you know, they're very welcome.
So yes, basically we know that telomeres get shorter and shorter as we age, but we don't know yet that extending their length means the fountain of youth. We don't know that at all, unfortunately.
Yeah, let me go to a couple.
I'm just gonna, just in case Maria has a problem hearing the question, Maria, Pat's gonna get some more questions, and then I'll relay them again. Okay. Pat.
Well, this is kind of this is a question from a high schooler. He's a junior in high school. He's taken some classes with a buddy of his that is very interested in this science. He wanted to ask Aubrey, is the free radical theory dead or obsolete? Is your book on the free radical theory outdated, or is the info still relevant since I'm planning on giving it a read? What kind of applications does machine learning have in this field, specifically with genomics and proteomics? Yeah, so
all right.
Yeah. So Maria, the question's about a book that Aubrey wrote, and it's a high schooler asking the question that's watching online.
All right. So with regard to the second part of the question about genomics and proteomics and machine learning, there's a huge amount to do in that area. I believe that we have a good chance of really finding out things about what the genome is telling us and what the proteome and the metabolome, for that matter, are telling us using the most sophisticated techniques that are being developed right now. In fact, at our conference in Berlin in March, we're going to have an entire session on that. We'll have talks covering all of those areas. So I hope we'll be able to reveal some very useful new data then.
Sorry, go ahead.
However, to do with the first part of the question about the free radical theory, well, first of all, the book that I wrote back in 1999, that effectively was my PhD thesis, and it's definitely not a book for high schoolers. It's very, very technical. If you want to understand a bit more about what I think in that area, then chapters 5 and 6 of my subsequent book, Ending Aging, from 2007, are a much better place to start. Even that's fairly technical, but you might get through it if you work at it. So to answer the question that was asked, is the free radical theory dead? Absolutely, it's not dead at all. We are still absolutely, we can be absolutely as certain as ever that breathing remains bad for you. It's definitely something that creates these toxic molecules that damage DNA and damage proteins and cause the accumulation of many different types of damage. What we can say, however, is that certain old and simplistic versions of the free radical theory are dead. We know, for example, that antioxidant enzymes and indeed dietary antioxidants do not change things much. If you eat a huge amount of vitamin C and vitamin E and so on, it doesn't really do much good, whether you're a human being or a mouse. And that was for a long time quite paradoxical, but it's now pretty much understood that the reason is because free radicals do their damage very quickly. You know, they get created by mitochondria, and then they immediately react with something very nearby in a space where they can't be kind of mopped up by these antioxidants beforehand. Also, it turns out that antioxidants, by virtue of the chemical nature of how they work, if you have too much of them, they can actually be pro-oxidant. They can actually exacerbate free radical problems. Now, there are other experiments that have been suggested to be challenges to the free radical theory, but again, they're only challenges to certain rather simplistic versions of it. An important area is that people have made mice that have a diminished amount of certain enzymatic antioxidants, like superoxide dismutase. And by and large, those mice do not live any less time. But we have to remember, again, that those enzymes do not actually necessarily protect against the ongoing basal level of creation of free radicals. They're really only there to, or at least they're only there in such high concentrations in order to mop up spikes in the concentration of free radicals that may occasionally occur as a result of metabolic irregularities. So no, I don't think there's any challenge to the free radical theory, but one does have to be careful in describing it and describing what it actually says and means.
I used to be a free radical.
What do you do for that?
Well, you get married. You know what I mean? That's what happens.
I got it. Okay.
Pat, you got any more?
Got a bunch here. Let's see.
Yes, a bunch.
Somebody asked.
See if you can find one. See if you can find one for somebody else for once. I've answered like 8 questions in a row.
Yeah, find one for Robin.
Yeah. I'm sure, well, these guys don't exactly tell me who they're asking it to. Let's see. All right, let's try this one. Recently, I read about tissue nanotransfection, TNT, from researchers at the Ohio State University Wexner Medical Center and Ohio State's College of Engineering, and it pretty much blew my mind. We have been talking about it a lot here in HealthSpan. The claims of what this technology can do sound almost too good to be true. What struck me in particular was that they are starting human trials already next year. Are you familiar with this technology, and what are your thoughts on its impact on rejuvenation research?
Well, I better answer that one anyway, even though
we'll get to Robin next, maybe. Yeah.
So yeah, that technology is very exciting. It's very preliminary and new. I don't really want to say too much about it reliability yet. I think it should be extended and repeat. I can, as I seem to be saying rather a lot about the lead researcher on the people speaking at our conference in Berlin in March. So, you know, we are definitely hitting all the high points with that conference.
Yeah, so just to follow up about that, since you've mentioned the conference in March, are you going to record the various discussions and maybe make them public?
Quite what's going to happen there. At the moment, we are really still at the early stages of those kinds of decisions. The conference is being funded and underwritten by one of our major donors, the Forever Healthy Foundation, Michael Grieve and his colleagues. So, you know, they're making most of the decisions in relation to things like that. Yeah, watch this space. I don't know the answer yet.
Have we said when the conference is and all that yet? I think we haven't, right? It's March 15th to 17th in Berlin. Yeah, that's what I wanted to say.
No, I can't hear anybody.
Oh, can you hear me? No? I'm not there.
I can hear you.
Oh,
I can hear you.
Okay.
I can hear you.
Aubrey?
I think you're back. Everyone went. Now they're back.
We're back.
Okay. So our conference is March 15th to 17th in Berlin, and you can go to SENS.org for more information, or foreverhealthy.org.
Yeah, that's a great website, the SENS Foundation website. I was on it today, and it has just a tremendous wealth of information on there. So Robin, what's going on for you? Patient as CEO, and you've got all kinds of flights to various stages that you have to get on and just emote and tell people that their life is in their hands, right?
Yes. Well, yes, it does come down to taking control and responsibility for your own healthcare and for your own life. Because at this point, up until now, we've essentially been victims in the healthcare system. We're victimized by our own bodies. We're victimized by the healthcare system, the bills, waiting times, having to take off work. Like, everything is torture when you're a patient. And I'm saying stop looking at it as a victim and start looking at it like a CEO. Hire the best people around you, the best doctors, nurses, chiropractors, massage therapists, whatever you want to go to. But you are the one who is the key decision maker, and you are the one who is ultimately responsible that the vision is carried out and that the company overall or your healthcare system overall is successful, right? And so the main purpose of my keynotes are the different technologies that are allowing patients to take control of their health, as well as how that's impacting medicine overall. So things like artificial intelligence, robotics, sensors, cloud computing with genomics and the microbiome and how that's impacting patient care, and even being able to utilize the power of the crowd for things like smart patients or patients like me, because sometimes your best source of information is going to be other patients who are going through exactly what you've been going through 24 hours a day, 7 days a week, versus the healthcare professional you see for 10 minutes every 6 months.
Yeah, absolutely.
I'm so happy you're doing that. I want to add, Robin, and thank you so much for that. I've been myself on a journey to achieve my own health, and I went through a lot of things like you did with health. And I had tons of problems with doctors and misdiagnosis, and I had to do it myself. I had to learn myself. And today you can. There's so much information. We live such different times right now. You can even get your own blood tests and take care of, check your genes, and then you have your own blood tests, and then learn about what they mean. And there's, I think,
I can't hear anyone right now.
What? I can't hear everyone. You lost us? I
hear you.
Anyway, I just want to say thank you. It's really, really important what you're saying. And that's exactly
and what you guys are both saying, it is absolutely critical. And recently we had somebody join us for a conversation. I don't know if you've heard of this guy. He's in California. His name is Bas Rutten, and he's a mixed martial arts legend. This guy is a legend, and he's going to be on TV on Kevin Can Wait on Monday nights. He's like a celebrity, but he's also legit. Like, the guy is a fighter, So he had some sort of injury, and he had volumetric muscle loss, probably nerve generated in his arm, but also he had a lot of, difficulty with his knees and his elbows. And so he ended up flying to Panama and having stem cell treatment where he had stem cells injected into his kind of his sockets, which didn't end up working because he didn't have any cartilage there for it to grow on or whatever. But he also had a blood transfusion, like a blood transfusion with stem cells, and said that he felt amazing. Like it was like energy was coming out of his hands, you know? And I just wonder, that's like an experimental type of thing that he just went and did. But I don't know if you remember, Pat, he said he was sitting with like some other famous sports person that was like, oh yeah, I do it, you know, in Panama. Do you remember who he said it was? It was like Roberto Alomar or Sammy Sosa or somebody. I mean, it was somebody that you'd recognize, you know, that was doing this. So, you know, this goes under, I think, the FDA saying, hey, the latest thing saying, be careful what you do, you know, but part of me feels like, look, if I feel like through the marathon running that I'm doing, and actually Pat and I are going to run a marathon in a month. So we'll probably close that. Yeah.
There's a lot of safe experimenting that you can do nowadays because you have access to all these tools, and I do it myself. I know that I have, for example, a bad gene that raises my homocysteine levels and lowers my folate levels, and so I take folate, extra folate, and then I test my blood every month. And as long as I keep the folate high, I know I'm safe from the MTHFR double mutation that I have. That means that I can have blood clots, and I regulate my DHEA levels and tons of things that you can do yourself that are on the safe side. And if you wait for doctors to do that, they have no clue. They just don't.
How did you find that out? Was it a website, or you just kind of?
There's a lot of websites now. Yeah, you can look under, you know, biohacking, self biohacking. You know, you start with your genotyping first, and then from then on. Yeah, there are a lot of resources now, and I am planning myself one that is gonna be longevitybridge.com, so you can keep an eye on it because we're building it with my husband because we want to guide people through all the things that you can do nowadays that people they don't know where to start, and there's a lot of stuff that is happening and people just don't know. Yep. And it's what Robin was saying. You can take care of your own health, get in your you know, be responsible for it right now. Oh, someone left. Aubrey left.
It's okay.
He had a bad connection.
Yeah. Sometimes it's good if you have bad audio, you could quit and then come back in.
I did that before. Yeah. Yeah, I did that.
So, you know, Aubrey was saying that, you know, breathing was one of those things, the air that you intake is such a critical part of your health. Would these air purifiers and things like that help?
No, I think he was referring to something that happens at a metabolic level when we breathe, the oxidation. So that breathing really is deadly. But
I mean, is it because of what's in the air, or could that be filtered out?
No, it's a natural process in our bodies.
Oxidation.
Yeah. Oxidation. Yeah.
What we need to live also over time. You know, it's just what he's saying about like a car. Yeah. If you don't take care of it, it ends up breaking down. And then
it's just it's this natural wearing down. So what we are doing at SENS, instead of trying to understand completely the metabolic processes and how they work and in changing them, what we're trying to do is to address the damage that is caused by the metabolic processes. Just like a maintenance approach, like engineering approach, or like you fix your car, you change your tires before, you know, they break. So instead of trying to change, you know, the whole, because that would take a long time. So if we keep fixing and removing damage, we can prevent pathology. So it's preventative. Yeah. But it can reverse also. It's not only preventative, but it also reverses damage. Yeah.
There was another question, Robin. Someone wanted you to talk about organs and then how each one of them, the potential of regenerative, you know, being able to regenerate. What would you want to speak to that?
Sure. So regenerate, or actually tissue engineer new ones from scratch, or using an existing scaffolding for transplants. So they're essentially two different things you're talking about. But when you're talking about tissue engineering right now for fully vascularized organs, heart, kidney, lung, liver, right? We're looking at least 10 to 20 years away from being able to successfully do this. There are different methods that people are using. One is out of Lung Biotechnologies. And I love what they're doing. But what it is essentially they take an existing organ, whether that is from an animal like a pig or from a human being, decellularize it, which means essentially wash away all the cells, and leave the scaffolding in place so that there's something for the stem cells to grow on. Then repopulate it with the patient recipient stem cells, and that grows on the scaffolding. There's still some limitations. The vascular part of it is very difficult, so you can also potentially leave the vascular system in place. Places like Harvard, Jennifer Lewis's lab, they are working on being able to 3D print capillaries and had a major breakthrough about a year and a half ago. So putting these technologies together, we'll be able to actually fully engineer, tissue engineering, an organ that you will not reject because it's based on your own DNA.
It's wild.
Right?
Let's see.
Sorry, I was muted. Aubrey emailed me that he couldn't hear any of us for the past 10 minutes or so. That's why he logged out. But
you want to
I think he's gonna.
You could ask him to try to reload or not.
Yeah, I just did. Let's see if he does that. Yeah.
As a biohacking enthusiast, I would like to know some opinions on niacin, rhodelia, sceletium, adaptogens, and bocapum.
Well, you're having a hard time.
No, let's skip that one. That's a little over my head.
Why don't you copy it and paste it in the chat space?
Probably not a bad idea.
Yeah.
Listen, you guys too now.
Yeah. Let's see. I could do that. How about that? Anybody want to tackle that?
Welcome back, Aubrey.
Hey there. It's okay for now.
Would you go shoot a game of pool while you're away?
I wish.
If you see in the little chat box, I just sent, that's some high-end technical words there for me. Does anybody have any knowledge on those things that the guy wrote? Hans Turian? No.
Yes, so Aubrey, you just jumped in at the same time Maria hopped out. This was for Maria about biohacking, different things that you can take that help in your personal space, you know. So this was a question for her. But
yeah, no, I don't know anything about these things, I'm afraid. I don't have anything to say.
Yeah. She had to hop out, she said. Oh, was that Robin? That Robin had to hop out, but you hopped back in.
I have to hop out now at 5.
Oh, you do? Okay.
That's why I even got the door, because the door was
Yeah, I have to go in a couple of minutes as well.
Okay.
Well, hey, it's always a pleasure having you guys. I hope you'll join us again sometime just to kind of kick the can around again, because this conversation is starting to gain traction. So.
Absolutely.
Well, thanks, guys.
Thanks again, guys. Really appreciate it. Enjoy. And for everybody else, please subscribe to the channel. We're going to have a lot of interesting conversations in the future. That's my cousin Matt over there. We're going to be running a marathon next month. And I haven't started.
How are you doing with that, by the way?
Not too well.
I'm sure.
I haven't been able to get out of this place. You know, I'm trying to.
Well, you know, they say that really it's in your mind. You know what I mean? And I think that you're strong there. So you're gonna push through it.
Oh, no doubt about that.
And I'm gonna be there with you.
It's interesting though. You know, when we were talking about, you know, longevity, right? So if you do use purifiers, are you helping your health?
I'm sure you're helping your health.
Right.
Not so much because of like the free radicals that people were talking about, but there's just pollen and dirt and schmutz that's in the air that if you're using a purifier or a water purifier.
Yeah, particulates or whatever. I mean, I got a little water tester, and I went in and I tested all the different bottles of water, and then I tested the tap water, and it's crazy. I mean, they all differ, you know, in the different particles and stuff that they have, and then, you know, after you put it through your purifier, you end up with good water. Hello.
Hi.
Welcome back.
We're just kind of, no, it's okay. We're just kind of, we had a couple people jump off, but we were just kind of chit-chatting, and we can continue.
I guess we're not in the future yet.
That's right. It's pretty,
yeah,
it's
not
pretty,
quite.
It's pretty cool that you could bring a conversation to the masses, and you can have people asking questions and stuff. I'm going to be much more tuned into the questions, because it seems like everybody writes these long-winded questions, and I'm going to have to either have Marvin break them down and into a.
Well,
I didn't know who.
What? While you were talking about it, there was a question for you, Maria, just before you hopped off, from a person who was into
someone asking about
biohacking.
niacin, I think.
Yeah, so Pat posted the question in the chat box.
Yeah.
So if you could, can you see it?
Let me see if I can see it.
Yeah.
Hold on. I have a little bit of a mess here. Okay. My computer was dying. I just plugged it in. Let me see the chat. Open the chat window. Oh no, I can't see that in the chat window. I only see the link that you sent me earlier. But yeah, I do take NAD+. It's hard to tell if it's helping me or not. Let's see. I see something here. Biohacking enthusiasts, I would like to know. So niacin, rhodelia. Yeah, I haven't taken rhodelia, sclerotium. I basically take NAD+. I take Therapure, that is similar to resveratrol, and which is a combination that Elysium has. I don't know if you heard of that company, Matt, you guys.
I have heard of Elysium, actually. Yeah.
So, but I buy the ingredients separately, and it's more inexpensive that way. And I take quercetin. I take DHA, because I think it's very important to have those levels high. CoQ10. A bunch of things, a bunch of other things. I'm considering metformin, because when you get to a certain age, you start being insulin resistant, and metformin really helps with that. So most of my friends, scientists actually, and biohackers are taking it. So I'm considering it. Only that I'm very, very skinny, and I need to look into that to make sure I'm not going to lose more weight. But I take all these supplements. I also suffer from lupus, so I have to be very careful with what I take. Yeah, but it seems like all these things that I'm taking are helping me with that. I also take biocurcumin, which is a big anti-inflammatory, and what other thing do I take that is important to say, and that is not that common? CoQ10. I can't think of it now, but I'd be glad. Anybody can write to me at maria.entraigues@sens.org, maria.entraigues@sens.org, and I'll be happy to send them a list of all the things I take. Of course, that everybody has to take different things. Well, not all the same. As I said before, I have, for example, this double mutation that I am trying to control, so that gene doesn't express and does something bad to me. But everybody has to find out what their own needs are, and yeah. But what I was saying is that we don't know yet what specific biomarkers to look at to really know if things like NAD+ is helping us or not. We know that our levels go down, and it's good to have. We think that it's good to keep them at. We want to keep everything in the way we had it when we were young, right? So we believe that if we keep levels of chemicals in our bodies more or less like they used to be when we were young, that should be a positive thing. So that's in a lot of the things like these supplements is basically what we know, mainly what we know, and why we base what we base on. Yeah.
Well, Oh, okay. I just wanted to really quickly ask you about, I happened to read a little bit about, there was like an interview that you had about a moment that you had in Japan where you were getting on stage and you were with somebody really famous was about to sing.
Yeah.
Can you walk us through that? Because that sounded like an amazing time.
Oh, well, thank you for asking me about that. Yeah, that's, well, I am a singer, songwriter, and I spent most of my life touring around the world, and I've been very lucky to sing with a lot of big artists, internationally renowned artists, and one of them was Eikichi Yazawa from Japan. And Yazawa is a wonderful, incredible artist who, when I was on tour with him, he was turning 60. It was his 60th anniversary, and he's a little bit of he's like a Mick Jagger meets Rod Stewart, Michael Jackson, kind of artist. And we had this beautiful, beautiful tour. When we opened the tour, it was at the Tokyo Dome, and the Tokyo Dome can fit 95,000 people. And I did a lot of tours, and I sang in a lot of stadiums, but I never seen anything like this. And it is this modern stadium that has a floating ceiling that is kept in place by the pressure of the air inside of the stadium. It's a very, very special, futuristic place. And when I went on stage, I just went on stage like I did hundreds of times before in my life. And I stood on my riser, and the lights were off, and then suddenly they had a lot of special effects. It was really a fully blown tour. With the crew was 300 people, and they had all these people walking on stage back and forth, dressed as Yazawa was dressed. So when the curtains went down, the people started walking back and forth. They were all wearing white, and you could see about 300 people on stage walking and just mixing with each other back and forth. And then suddenly they all leave, and one of them is Yazawa that is in between all of these people. And when people see this, everybody just, it was like a big roar. It was like one giant animal going "Wah!" at me, and I felt the physical push. I felt I was gonna really fall on my back, and it was that's what you're referring to, right? That part of
that part.
It was very special. It's hard to
experience.
You have to live through it, but I
once
felt
in a lifetime.
It moved my physically. Yeah, it moved me physically.
Yeah.
That's awesome.
It was beautiful. Yeah, it was beautiful.
So
what's going on, Pat?
Well, there's a lot of questions flying by, and let me try to pick off a couple of them here. Let's see.
So I guess Aubrey and Robin left.
Yeah, they said they had to go at 5 o'clock. So
okay.
Yeah,
okay.
They had something they had to get to. So if you need to go, just let us know.
I will. See,
that's my.
To go, but
yeah, that's my cousin. So we're family. We can't go. You know what I mean? So.
Where is he? Where you are different cities?
Yeah, I'm in New York City.
Oh, okay.
Yeah.
And, Patrick is a stuntman in New York City and works in the movies. So he's
I worked in movies for a long time too, but in music, yeah.
Good for you.
I love movies.
I could just tell you. I could tell you have a lovely voice just by looking at.
Oh, thank you.
Your energy, One of the guy named Anthony Storm here says that you look beautiful.
Oh, thank you. I appreciate it. I appreciate that very much.
You sure he wasn't talking about me?
Probably not so much. But,
okay, just saying.
Yeah. So lupus, huh? I did a report on lupus when I was like in 8th or 9th grade. I remember I had to pick, something that, you go through all the different diseases and stuff, and for some reason I picked out lupus. That's a very interesting.
Yeah, I take something called hydroxychloroquine for it that is mild and it's not an immunosuppressant.
That's good.
So it's like the starting, med you can take for lupus. There are a lot that are much stronger. So I'm doing well with that. Yeah, I haven't had problems for at least 4 years or so.
That's so good.
But there's a new medicine, if there are any lupus sufferers listening to this, that is called Lupuzor, that is coming out this year. It's actually, in 18. They're finishing now the phase 3 trials. And it's a peptide, and apparently it's going to be a game-changing medicine, and I can't wait to get it.
Huh.
Yeah.
Very cool.
That's interesting. My ex-girlfriend's mother had lupus as well.
Yeah.
I'll have to tell her about that.
Lady Gaga has it too.
Oh, is that right? Wow.
Yeah, well, a lot of celebrities, and they're active and they're okay, but you never know when can strike, and it's a scary disease.
So let's see here. Yeah, so they're just, see if I can pick a good one here. Let's see, we need oxygen. Okay. Let's see, Ellen Specteron. Remember, you need oxygen in your blood. It goes to the brain, though, your whole body, through your whole body. If the air you breathe is not clean, which is a rare thing, more bad stuff goes in your body. Yep, this just goes back to my question about
Yeah.
longevity is really all about health. So for me, like the better food that you put in your body, the more clean it is. So your water, if it's, I don't know, no fluoride or all these different particulates or whatever that exist in different chlorine and all these different chemicals that just find their way into the water supply, or even bottled water, the plastics and BPAs and all that stuff. So I think the more you stay away from that, wouldn't that help your longevity? Like live longer. Same thing with the air. The air that we breathe.
We know that all that stuff helps. Yes, of course, the healthier life you can live and your lifestyle. But what we're working on is totally different, though. Yeah, because if you do all the good stuff, everything, all of it combined, you're going to still age and die of it. And that's what we're trying to change.
Right. That's wild.
Yeah.
So a lot of these guys that are asking questions are young people that want to know where they should start.
I love that.
Yeah,
I think that's fantastic.
It's really interesting.
Because when I was young,
they should study tissue engineering. Read up everything on that. You should look at CRISPR-Cas9. What's CRISPR stand for again, Maria?
Oh my God. Let me see if I can bring it back to my head. Yeah, hold on. It's clustered. Okay, here I go. Clustered regularly interspace short palindromic repeats. That's right.
You got it. That's what it is. So all you youngsters out there, it's CRISPR. Put it all in capitals. CRISPR Cas9. All right, and you also, so that's tissue engineering. I'd say bioprinting because we're big on bioprinting. Then CRISPR-Cas9, and then stem cells. And what you want to get is, it's not like in the past it was embryonic stem cells, which was really scary and terrible. But now it's like you can get stem cells from the placenta, from the cord blood. So if you're young and you're going to have a baby, save your cord blood. Okay, this is a good idea for you.
Bank it.
There's something new that is a very exciting field, that is senolytics, which is removing senescent cells from our bodies. Mm-hmm. And there are many companies now, and one of our spin-out companies actually is working on that too, that I already mentioned before. So we've seen really interesting results in labs, and there's actually one company called Unity that is going to start human clinical trials very soon. So apparently, awesome. If we can remove the cells that are just not dying, but they are around, floating around, but not doing what they were supposed to do or they used to do, they become senescent. If we remove them, apparently that's really good for us, and it can extend our lives. Big deal.
Yeah, that's awesome.
Well, people freezing the stem cells has been like a seriously growing industry, where it wasn't. I don't believe so. Like, you didn't hear too much about it 5-10 years back, but now it seems almost on the regular. People will be offered, hey, do you want to, jump into this program where we grab stem cells and save them for later and see what happens. And now the science is starting to evolve, where now they can go back to these.
They cryopreserve. Yeah,
right. And
exactly.
Then they use the stem cells to crack some of these codes and some of these issues that people are having. Pretty wild.
I mean, it's a good thing. It's a good thing to save. But in addition, they were talking about the doctor from Japan with the iPSC cells, and we were talking with Sangeeth on one of our other podcasts that we had. They can isolate stem cells, your own genetic stem cells, from your fat, from urine, from your skin,
bone marrow.
you know, bone marrow, right? So if you need the stem cells, you can have them harvested from your own body. The question is, when they induce pluripotent stem cells, there's a little question out there is what happens when you manipulate the cells, whether or not they in the long term cause damage or not. But there's real promise that you don't need it if you don't have it, meaning that you can work with what you have as an adult. But I think it's a real benefit if you're having a kid to save their young, because that young blood is the most powerful stem cells there are.
Right.
Yeah,
Does that sound right to you?
There's a lot of excitement about young blood plasma now, transfusions, and what came from the parabiosis studies when they connected two mice that share their the blood.
I did read about that.
Yeah, and then now what they're doing is they're taking young plasma and giving it in the blood, in the veins, for to all people, and apparently has huge benefits. So all the healing factors, stem cells, the thing about freezing your cells, they're saying it's better to do it when you're younger, obviously, so then if you need them when you're older. But at the same time, there's this all other new idea that we know that in the future we're not going to need to do this, because we're going to be able to manipulate. So it does the cells and the genes, and so we're not going to need to save cells now, because we're going to be able to create anything we need in only 10 years or so. Michael West was saying this at Rad Fest, actually. So he was saying it's a waste of time to save your cells now, to freeze them.
Pat,
well,
Pat, you might get lucky with a new face. You know what I mean?
That's it. You never know. Yeah. Be able to smooth it out a little bit, get the wrinkles. So your admirer, Anthony Storm, wants to know how long we could preserve stem cells. How long will they last?
Well, I don't know the exact answer to that, but I am a cryonicist. I'm an Alcor member, and so I know a little bit of stuff about cryonics. And if you have the cells cryopreserved with the cryopreservants that we have nowadays that are very advanced and keeps the cells in pretty good state, you can preserve them for millions of years.
Yeah, forever.
Yeah. There's no limit. It's very exciting.
But it's only the young cells, like we had, in vitro, so we had embryos that were frozen, and you could keep them forever. But
sorry. Go ahead. Sorry. I thought you were finished.
No, I was just going to say that's after the cells divide to a certain amount of cells, you can't save them anymore. It's impossible right now to cryopreserve them. I know they're in discussions and looking at frog studies and this and that, like how to make that happen. But cryopreservation right now is really about young, like small groups of cells, embryonic, or blood, right, or stem cells.
Yeah, the technology in a bio. I don't want to say the wrong term. Cryonics. No, I want to say bio. Because some people say cryonics, but technology is advancing a lot. So it's proving a lot of it's showing a lot of good results. People, like you were saying, the embryos. Some people freeze one embryo. There's a story of this woman that had twins, and she was going to deliver twins, and then she kept one of the embryos for 10 years, and she had one of the babies, and 10 years later she had the other one. So she had twins that were 10 years apart.
But they're the same age. Yeah.
No, they were 10 years apart. They were not the same age. So it's a way of pushing aging. It was really interesting. Yeah. So they were 10 years apart, but they were conceived at the same time. But one of them was frozen in time, right?
I know what you mean. I do.
So I want to give a shout out.
I wanted to say cryobiology before. Sorry, cryobiology. Yes, go ahead.
I want to take this time to give a shout out to the HealthSpan Discord community. They have been very supportive of our live casts, and you can join their group. I guess it's in the description of our video. So just wanted to say that. Ozzy is up here, and he is saying that his dad is getting his knee done with stem cells. So
that's awesome. Ask him where he had it done.
He is getting.
Where did he have it done?
He's getting his. Where is he going to get it done?
And what kind of stem cells?
Like Texas or New York, or where's he getting it done?
Ozzy says it's going to be around $6,000 to get his knees done.
Okay.
Let's see. Don't bother. Matt and Pat, are you on board with the fight against aging? We are definitely on board with the fight against aging.
Yeah, right.
Of course.
Germany's the best bet for health tech in Europe. That's what Bitcoin.
Come to our conference, Berlin, March 15th.
Yeah, and for the conference, March 15th.
Oh, so Ozzy says California is where he's getting it done.
Okay. Where? Can he say where? Because I'm interested in knowing how many people are doing that now for joint regeneration.
Let's see.
I didn't know you could do that right now.
Ozzy,
cool.
Ozzy, you want to let us know where he's getting it done? He said the lab. Maybe
the lab.
It's called the lab.
Oh, he doesn't want to say the city.
Okay.
That's fine.
No problem.
But the cool thing about this is that you just it's coming up more in conversation that you hear.
Yeah.
Well, yeah. Tell Ozzy he's got to let us know what happened. He should maybe hop on, or have his dad hop on.
Ozzy, keep us clued in, and maybe if you want to have your dad jump on to one of these casts, that would be cool. It'd be really cool to get a first-hand person in the story. That would be great. But as I was saying, it's just really great to see that we're here and that this is becoming more prevalent.
Yes, it's moving very fast.
So
now it's moving fast. Yeah. When I started working on this, it wasn't, but now it's
almost like Bitcoin. Like 5 years ago, you didn't hear anything about Bitcoin. Now you hear, like, you're in a grocery store and you hear people talking about Bitcoin. You hear them talking about stem cells. You hear them talking about all these different.
It's very exciting.
Yeah, it is. It's exciting time to be
There's nothing more important than our health. I think everybody has to agree with that. And the thing with aging is that we lose our health. That's mainly what it is. Mm-hmm. So, some people, you must know that there's some controversy with it sometimes, and people think that it's not something we should be doing. But I asked them, but it's the same thing you would do with any disease you get. And that's what you get when you age. You get diseases and you always go to a doctor when you're sick, or most of people at least do. So this is the same thing. We can't ignore it.
That's the real fight for SENS and for Methuselah, is just to get people out of this sleepwalk that you think you just get old and then you die. The reality is there's technologies that are emerging that can help to clean out your body, the bad cells along the way. And it can actually create gaps, like stretch the longevity so that you're within reach of newer technologies that come down the road.
And the problem is that gerontology and geriatrics, the approach we have now is not working. We're just extending the life of people in really bad state, and we're not doing anything. We're just ameliorating symptoms. We're spending $40,000 a second only in the US for nothing, because we're not curing anybody. We haven't cured one degenerative disease, not one of them. We cured, infectious diseases, but not the ones that aging brings. So it's time for us to look into that. It's amazing that we haven't looked into it before for so long.
Yeah. We're going to, and we're doing it right now. Yeah.
Yes.
I do think some of the first steps, though, is just to take care of your body, soul, mind, everything. Your spirit, as you are now, which can be done by nutrition, by going to the gym, by having healthy conversations, by understanding new future sciences and stuff like that, is always great for the future. But the now is like how you eat, how you live, the air you breathe, the water you drink. There's just, I think a lot of this stuff is caused by GMOs and vaccinations and all these different things are something that I'm also very interested in, and hopefully we can have some conversations about that. But I'm definitely down with the anti-aging. Anti-aging is just is wonderful, and to have you guys on here, and to be able to have a conversation and to invite other people to have questions, and hopefully Ozzy will bring his father on, and the more and more people know about this stuff, the faster it's going to go, and there's nothing like being part of that conversation to push it forward, and that's what my cousin and I are trying to do. I mean, we got really interested in in this whole arena because of Organovo, which is doing some amazing stuff with.
Of course, that actually, I think it was Methuselah gave the first seed money to Organovo to start.
That's right.
We were very close to Organovo. David did it, right? Dave Gold, yeah.
And it's funny how you learn things, because my interest was in 3D printing, in regular 3D printing. And so we have an animation studio, so we were 3D printing our characters. And then my cousin came up here, Matt came up here for a marathon, and we started speaking about 3D printing and what the future is. And then Matt came across, he said, oh wow, they're bioprinting, and what? 3D
right.
And so we got more about that, and then we started having this like pretty much daily conversation surrounding Organovo and tissue.
Oh, what are they gonna do? Oh my God, are they gonna do that? Imagine you could use it, find out, test it on shampoo. You can test.
So
then you see hair follicles growing
because lives, right?
Yeah. So and then
imagine we can print organs. We save so many lives.
Yeah, we kept that at the forefront.
Well, yeah, and
we kept that.
The
at
latest
the
is that
like,
I'm just saying, saving lives and printing organs. The latest from Organovo is they printed a liver patch that they put in a mouse that had inborn error metabolism, so it wasn't able to metabolize through the liver, and it perfused and it attached, and it actually, they measured the blood serum, and it helped this mouse. So this mouse, they studied it at like 14 days. Then they had a mouse that they had for 21 days. And they had a mouse, for 60 days, 90 days. And they're on the way to like 120 days, where this mouse shouldn't have survived with the metabolism error that was genetically in it.
Yeah.
So that's exciting.
And first and foremost, our interest has always been about, the science and it's saving lives. It's not about, okay, we're going to, hopefully one day you make some money off the stock or whatever. But, what's first and foremost is that they're breaking ground and saving lives. And that's always, at the end of our conversations, we always say that's what the most important thing is, that,
saving lives and stopping suffering. Also, I think the healthcare system, the way it's set up now, it's a paradigm that we need to shift, because it's not. It seems like it's on a crashing course. So I think all the new technologies for the elderly are going to change this. And think about this: that we spend more money on health in the last year of our lives than in our whole life together.
Wow.
Think about
That's
that.
crazy. Yeah.
I saw that. That's true with both my parents, for sure. I mean, it was all just, the last year of their life was just medical bills, drugs, doctors, in and out of the hospital. Yeah, it's crazy.
So sad. You just really, I know it sounds rough, but you're just extending the agony. That's all you're doing, because maybe they feel a little better for a little bit, but eventually they're just going to succumb to all these diseases. So this has to change, definitely.
Yeah.
It will. Well, we need all the support.
Yes, absolutely.
To make it happen faster.
Yep.
Well, Maria, we're hoping that you can maybe join us again another time, because we really appreciate your insight. And
thank you so much for having me, and thanks for doing this. We need a lot more people like you doing this.
Yeah, we're gonna keep doing it. Yeah.
I wish you all the best with your documentary too.
Thank you. Yeah. Well, it's actually it's Dave's documentary. He's here. He contacted me from the UK, so he's trying to put together a lot of people are doing that. We are getting, all of us in the field of life extension, we're getting a lot of interviews, and I actually going to Scottsdale in a couple of days for an interview. Some people are coming from Germany to interview me, and then some people from Spain spent a couple of days with me, following me around to see what my lifestyle is like. And people want to know.
That's
so
great.
But there's a lot of things, about your health that you can do now. So that's important, because until the therapists that we are working on come around, it will take some time. So we need to stick around and get into the longevity escape velocity that you probably heard about, that Dave Goebel explains, so that we can be here for a long time.
What's cool is the technology. I mean, your voice can be heard by so many people by, like online conversations like the one we're having now. Whereas you don't have to be like these guys. Some of the guys that come in and they said, "Oh, well, this Rad Fest was really expensive, so." You have to be there to get this information, but no, you don't, because now you can be in a forum online, and
you should be there. Raise the money. Don't get a cup of coffee.
Well, no. I don't want to get it twisted, but I'm saying people that can't afford it can find it in alternative areas, and people like yourself have been so kind to of
course
spend time.
They should have one in New York. You don't have enough stuff on the East Coast. You guys are all like way over there. You know what I mean?
I know.
You could always, if you ever want, and you want to have a live conference or something, and if you want to have it at my studio, and we could film it, and podcast it out, so it's like you're in the space with a bunch of people and an audience, and then we've done that before, and we're only getting better at what we're doing. We're really kind of in the infant stages of
early.
Of stuff.
By the way, with Rad, you can get all the videos from the event, and you should. And it's not expensive.
And somebody was also asking about the thing in Germany that's coming up. If they're going to be
tell them again.
They're going to be broadcasting that.
We don't know yet. We hope so.
What are the dates
but if we don't broadcast directly, live, we're going to have the videos available after, for sure, quickly after. So
because I think
March 15th.
I think it's pretty cool that we have so many young people that are really interested in where they're going to concentrate, their research, where they're going to concentrate their focus.
They should get into science.
Well, people are saying, like there's just so many things that they're throwing here. There's a lot of different curriculums, I guess, that they'd want to get into. Some of these people are computer scientists, and they're looking at
like Aubrey started. That's how Aubrey started.
That's fine.
It's all connected. It's all very much connected. AI. Now we're working with AI a lot, because we can advance a lot of things that otherwise would take a long time to do in the lab, and artificial intelligence is amazing.
So it's so much about the data, right? And
so if anybody has a question, remember, you can email me at maria.entraigues, ENTRAIGUES @SENS.org. I'll be happy to answer any questions, direct you to, places with, links, stuff, information. There's so much information, so much going on, and I'm happy to help. I gave a talk at Rad, the last Rad I performed, and I moderated it. My talk was about, I do not have more time to convince people that this is a good thing, but I do have all my time available to guide and help people who are interested and seriously want this to happen. So that's where my energy goes to now.
Great, wonderful.
Not to the people who come and tell me this is a bad idea. I don't have time for them.
Whatever.
Right.
Yes.
Yeah, there's a thing about
natural selection. Natural selection. Sorry.
There's like bad apples and there's good apples, and you just go around and you just leave the bad apple. You just go to the good apples.
I respect it. If they're not, I respect it. You want to age and you want to, that's your decision, But I honestly cannot spend the time on that.
They might not even be bad apples. They're just non-believers
and fear. There's a lot of fear. But maybe those are they will adapt to when they see that these things are actually good. I bet you they will go and take the pill when it's available.
Right.
There's a curve, right? There's the early adopters, and then there's a whole thing on it.
The pioneers like you guys are pushing the realms. Hopefully Matt and I will be able to as we.
I'm in. No, I'm on the team. I'm not like on the outskirts. Hopefully, we're doing it right now.
You are.
We're
Absolutely.
You're part
talking
of
to
us.
the
We're
people.
learning. We're learning.
Yeah.
I'm right with you. We're
Okay,
learning.
well,
We're invested. It's all good. I really appreciate your time.
thank you,
Goodbye.
guys.
It's been a great
Thank you so
conversation.
much for having us. And
Awesome.
I guess I'll be seeing you soon.
Great.
Yeah,
Thank
absolutely.
you so much.
Yep.
Live long and healthy.
Rock
Okay.
on.
Have a good one.
Do great.
All right.
Bye, everybody.
Bye, everybody.
Bye.
Bye.
Take
Do
care.
great.
Bye.
Thanks.
Thanks.
And everybody else, please subscribe. Hit the subscribe button. Do it now.
How do you think that went, Pat? I mean, we
think it
might
was
as well
good.
talk about it now. I
Well,
thought it was pretty good.
yeah, I think it was great. Let's see. We're going to push. Let me just stop this. Okay.